Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Pressure source. So it is nothing but the decubitus ulcer. So by definition, it is a tissue injury by physical pressure applied on the tissues from the external source or magnitude. So external source at a magnitude that exceeds the capillary perfusion pressure. So it is greater than the capillary perfusion pressure. The pathophysiology is that there is the external pressure, it exceeds the capillary occlusion pressure. So external pressure, it exceeds that of the capillary occlusive pressure. And this is nothing but of the 30 mmHg. And this leads to the perfusion stoppage. So perfusion stoppage. And leads to the ischemia as well. So perfusion stoppage, ischemia, that necrosis and the ulceration. So the other mechanisms include the malnutrition as well as the neurological deficits. Now let's look into the neurological causes. So what are the neurological causes? Neurological causes, it includes the syringomyelia, then it also includes the spina bifida, the spinal surgery, the peripheral neuritis, the peripheral nerve injury, the leprosy, the diabetic neuropathy, the paraplegia as well as the TBs dorsalis. So what are the common sites involved? The common sites which are involved, it includes the ischium, it includes the greater trochanter, the sacrum, the heel and the malleolus. So here in malleolus, the lateral is greater than that of the medial, and also the presence of the occiput. Now the staging of the pressure source we have already discussed in another video. Staging, it's already discussed. Then moving on to what are the complications of these pressure source. So when you look at complications, it can lead to the sepsis. So it is sepsis, it can be localized infection. There is cellulitis, there is osteomyelitis as well as the amyloidosis. So how do you prevent this? The prevention is through the good skin care. So there will be a skin care. And there is also the special pressure dispersion. And there is also cushion and foams. Next is there's a air fluidized beds, urinary and fecal diversion if required. Then turning bed bound patients at least every 2 hours. The wheelchair bound patients should lift themselves off their seats every 10 seconds at 10 minutes. For 10 minutes, at least for 10 seconds, the wheelchair patient should make a move. Then surgical treatment. So what happens in case of the surgery treatment? So here in the surgical treatment, there is a reserved for the cases with no improvement. So there is a no improvement and after the conservative management. So there is no improvement after the conservative management. So surgical options here, it includes the debridement as well as the vacuum assisted closure, the flap closure with a large skin flap, and intact sensory innervation. Sensory innervation will be intact. And a commonly used flap for the pressure sore is the external fascia lata flap. External fascia lata flap. So this is with a lateral cutaneous nerve of the thigh. To learn and grow daily like this, please do subscribe.